Okay. Hello, Dr. Schechter. It's so good to see you today. You're on Perfect Child, and thank you for agreeing to the interview.
Happy to be here.
Good. I want to start with your bio real fast, and I'm just going to go through it, and if you have any adjustments, please feel free to make them. Dr. Schechter is a physician who treats the whole patient, mind and body, in the context of family, work, and environment, while applying the most up-to-date medical research. He emphasizes prevention, a healthy lifestyle, and exercise as the mainstays of a comprehensive program. He has a degree in biochemistry from Princeton University, and he attended medical school at New York University. There, he fortuitously met rehabilitation professor Dr. John E. Sarno while seeking relief from a nagging knee problem. He achieved a rapid recovery after learning about tension myositis syndrome, also known as TMS, a diagnosis that emphasizes the role of emotional tension in causing and perpetuating many painful ailments. You okay with that bio?
Thank you very much. No, that sounds good. And I'm glad to elaborate on it with you during the interview.
Great. Let's start with, tell us about the knee problem that you had that led you to discover Dr. Sarno and TMS. What was the background of the knee problem, and then?
And so I was a medical student, and a couple of my big outlets were running and playing basketball. Really enjoyed them, and it was a stress reliever as well. And then I started to have knee pain, and it got kind of severe. So it sort of stopped me from doing the things I wanted to do. And I was at a medical school, so I sought out the student health physician, prescribed some anti-inflammatories, didn't solve the problem. They referred me to a very respected orthopedist who examined me, recommended some exercises, and eventually a scan of the knee, which didn't really show anything definitive. So I'm kind of stuck. I'm not getting better, and I'm starting to look in the library. What could be wrong with me? Is there something anatomical with my legs and all of this kind of stuff? And eventually I decided to walk into the office of Dr. John Sarno, who had lectured to us during our anatomy class. He was a rehabilitation professor. I thought he could prescribe some type of high-tech physical therapy or something, and that's what I asked him about. Then he asked me a few questions, and he said, you know, your pain's kind of becoming chronic, meaning lasting more than 3 months. He said, a lot of this chronic pain is psychosomatic. What do you think of that? And that really was a shock to me. I mean, it was a surprise. It was like a blast of Arctic air hitting me on his couch in his office. And I said to him, boy, that's not what I was expecting to hear. He said, well, I understand if you're skeptical. I have a seminar I give to patients on Monday evenings. Why don't you come next week? And if you think it applies to you, then you can be examined by me. I'll see you pro bono for free and make a diagnosis. So I went to the seminar the following week, and I went into a room where there were a lot of well-dressed New Yorkers, Upper East Side, Upper West Side, typically in their 30s, 40s, and 50s. I was 21. And he laid out his presentation of chronic pain and the mind-body connection and the emotions and the unconscious. And it really rang true for me. It made sense to me. It made me think about some back pain I had in college that went away after a while, but that could have been connected to stress. It made me think about an episode of stomach upset I had in middle school that might have been related to some social anxiety. And so I went to see him and be diagnosed. He confirmed the diagnosis. I began to feel like a weight was lifting off of me, that I had an answer, that I had a way to get better. And it was really more about what I thought about, what I felt, and how I dealt with my stress than it was about anything mechanical or structural. And my pain started going away. Over the next few weeks, I went back to shooting free throws and then running and then playing basketball. I had my life back, so to speak, and I learned a lot. So that's the beginning of the story. The following summer, I did a research project with him because I was very fascinated by this work, and I called up 175 of his former patients, and I began to hear the same kind of miraculous recoveries, where people who had tried physical treatments for pain in their back, neck, knee, got better from more of a educational approach, more of a psychological approach. And so I decided I would definitely want to do this work during my career, incorporate it into my career.
So, you know, when you say psychosomatic, a lot of times when you say to somebody, I think that's psychosomatic, don't they sort of get like the prickles and just kind of say, no? So what do you say to that?
Well, the word psychosomatic comes from the Greek, psyche and soma, mind and body. So I tend to use a little different language, and I try to really make it clear to people, I'm not saying this is imaginary. I'm not saying it's all in your mind, as some imply. What I'm saying is your brain and your nervous system is a key reason why pain tends to persist, why pain becomes chronic, or why other symptoms that can't be easily explained occur. And if we don't look at that part of your body, your brain, your mind, your emotions, we're missing out. We're not seeing the full person. You know, there's this kind of split in medicine a few hundred years ago between psychiatry.
Let's start again. Can you explain more in depth what tension myositis syndrome is and how would you diagnose it?
So tension myositis syndrome was a name that Dr. Sarno originally developed, although he did never love the name, and he changed it to tension myoneural syndrome toward the end of his career. Myo is muscle and neural is nerve. And I use the acronym TMS. There's another common phrase called PPD, psychophysiologic disorder, again linking the mind and the body. These are different terms for a condition where you have typically pain in the body. Could be back pain, neck pain, arm pain, leg pain, jaw pain. But all your testing and all your examinations really haven't revealed a clear cause. You've probably tried some other treatments, physical treatments. Maybe they've given you temporary relief or maybe no relief at all. And again, the doctors are not finding anything seriously wrong with you. In this case, we begin to look at the possibility you may have TMS. As we'll discuss in a few minutes, we look at certainly personality factors, some past history issues. We examine you looking for some tender points, and we make sure that you've had the proper workup to do the due diligence to make sure there's not something structural or biochemical wrong with you. The good news is this condition, TMS, once diagnosed, can be treated effectively. But the treatment is more based on the mind than the body. It's more based on the concept that education is the penicillin for this condition, and that education plus psychology can cure a condition that's real, but for which the nervous system and the brain is more responsible for its perpetuation than the body is.
And is this sort of like a lifelong treatment?
That's a good question. That's a good question. No, it's not a lifelong treatment. I guess personal growth is a lifelong issue, but in terms of the pain, some people get better once they understand that the problem is benign, that it's not serious, that it's not going to disable them. In the example I gave before of my knee pain that I related to running and basketball, once I learned that the problem had a solution, I began to start feeling better. And once I implemented that solution, I got better within a matter of weeks in my medical school age 21 condition. Now, for most people, it takes longer than weeks. It may take a few months, sometimes longer, but the treatment is not lifelong. And we'll talk about the treatment probably next.
Well, again, going back to that, I had a question I was going to ask about the treatment. Oh yeah, as far as it being, have you ever had somebody who comes in and they've been treated for, let's say, knee pain, and then it manifests somewhere else as like a back pain, and then they've implemented, you know, the learnings that they learned, and then it's gone away? Have you seen that sort of?
Well, that's a very good and insightful question, because many of the people I've seen, and let's say in their 40s or 50s, might have had tension headaches in their 20s, maybe irritable bowel syndrome in their 30s, and then they come in their 40s with 3 years of back pain that hasn't been properly treated or diagnosed, and I diagnose them with TMS, and they implement this program that we're going to talk about, and they get better. And so your insight is that a mind-body condition can move around. It can move around in the short term. It can move around in the long term. It seems like when stress builds up or emotions build up in the unconscious, perhaps, that it just kind of comes out somewhere. It comes out into an area of your body, such as your gut, your jaw, your back, headaches, various things like that.
Yes. All right. So you have mentioned journaling as a practice for reversing chronic pain. In fact, you've put out the MindBody Workbook for adults as well as for teens. Can you talk a little bit about that?
Well, one of the techniques we use is writing or journaling. So the idea is that if you take your feelings that you're having and they're kind of bubbling around your head, and some of them you're aware of and some of them you're not, and you're disciplined for 10 or 15 minutes a day, and you just write about things that upset you. You write about things that make you angry. You write about things that make you happy. And you do that 10 or 15 minutes a day, pretty much every day of the week, either in my book, the MindBody Workbook, or even in a blank notebook, that you'll begin to sort of make sense of things. You'll begin to process some of these emotions, become more aware of them, and get them out of their hidden crevices in the brain. And so that seems to help people considerably relieve their physical symptoms, as well as feel often emotionally better, to do that writing or journaling. So it's one of the techniques we use in the treatment program.
What I love about your workbook is I know a lot of times when I talk, I journal. And when I tell people it's so effective, you should journal, people are scared of it and they don't know what to do with it. And it's like, I get excuses like, where do you even start? What are you writing about? Or that's not something that I do. But what I love about your MindBody Workbook is that you sort of have steps and you walk people through it. And it's very simple. It literally will only take you like 5 to 10 minutes each time. And so
yeah,
then you kind of build a practice around it.
Yes. I mean, it can be very difficult to look at a blank notebook every day and say, okay, here I'm going to write. Some people can do that, but many cannot. So I wrote a guided journal designed around the concept of a 30-day journaling process, which is every day you get questions. And the questions are going a little bit deeper every week into different issues in your life, about your work, about your family of origin, about your relationships, about your stress and finances or other things. And so by doing the systematic journaling, you really learn how to journal so that after those 30 days, you can continue in a blank notebook. People often ask, is it enough to just think the answers? No, it's really not. It's really beneficial. Research has shown to write them. If you can't write them, you don't want to write them, typing is the second best option. The third best option is to record your answers. You have to actually do something with the answers rather than just think them. Oh. But I find that freehand writing is the best. There's some, again, research on the connection between freehand writing and the brain, that it's a different level of involvement than keyboarding right. on the computer. And it's different than recording your voice as well. So ideally, you write into a notebook or my workbook, and you gain both insight and understanding. Now, I wrote one for teenagers that is going to be part of a curriculum that I'm developing for middle school and high school. I feel so strongly that we have an epidemic, which I treat this epidemic. I'm not talking about coronavirus now. I'm talking about the epidemic of mind-body disorders, that in order to perhaps reduce this epidemic and prevent some of these cases, make them easier to treat when you get into your 20s, 30s, and 40s, I want to expose adolescents to the idea that what's going on in their mind and emotions affects both how they feel emotionally, but it also affects their physical health. I want to expose them to that through a one-week curriculum in the middle school or high school health education. And I've written a slimmed down workbook for these adolescents that's been approved by child psychologists, and which is, again, designed for that 13 to 18-year-old group that is typically in middle school, high school.
That's wonderful, especially now since there's a lot of homeschooling going on. So I would imagine that you could possibly lead a couple of workshops with homeschoolers of middle what is that word I'm
Middle
looking
school,
for?
high school?
Middle school, high school, right? I'm like middle age. That's not the right word. But yeah, to lead workshops, or even for parents who have school children doing remote learning.
No,
Like
absolutely,
they would
absolutely. I
want
mean,
to learn this.
we're testing it in a couple of schools. We're making some tweaks in the curriculum based on the feedback we get. And I definitely think that the homeschool market is really would benefit from this. But all types of education need more social emotional learning. You know,
Yeah.
they used to say reading, writing, and arithmetic. That's not enough anymore. And there's a lot of things
That's like
a lot of things you learn in middle school and high school that you're going to forget, or really it's not going to be a big part of your life in the future. But if you can learn about your emotions and you can learn how important they are, you can learn how to process them a little bit more effectively. We might reduce the epidemic of mind-body disorders. We might have an impact on suicide. We might have an impact on vaping. We might have an impact on drug use. And boy, that would be powerful stuff if we could start that younger. I get the sense that educational systems are a little more open to this than they used to be. Some
yes,
schools are teaching meditation to their young people,
yes,
but really to get them into the science and the application of the mind-body system would be a big boon for the young people and for their parents, and also as they get older, give them knowledge that they can use and apply.
right, absolutely. Now, this MindBody Workbook, it can be purchased separately from your book, Think Away Pain.
Yeah, I have a book called Think Away Your Pain, and I have the workbook. I've written a few other things as well. They're all described on my website, which you can see on my name tag here on Zoom, mindbodymedicine.com. I'm sure it's linked on your page as well. My other website, schechtermd.com. You have to write down the spelling of my name. But yeah, you can buy the book if you want to learn more about your chronic pain. You can get the workbook to deal with chronic symptoms or pain or other unexplained disorders that have been ruled out as anything structural or biochemical. And you can also get one for your teenager and see if they can spend a little bit of time for a couple of weeks. I didn't put 30 days on them, just about 2 weeks.
Oh, really?
Yeah, I wanted to make it a little bit shorter to fit in with the curriculum, you know. And so it's a shorter version, it's less expensive, and it's an introduction to these teenagers, explains what to do. Both the workbook and the teen workbook give explanation as to what to do. And I have a number of podcasts linked on my website that also talk about journaling. So if you don't want to buy anything, you can listen to some free podcasts linked on my website, mindbodymedicine.com, that go into more detail on how you do this journaling thing.
Yeah, I mean, I get it. I haven't listened to your podcast, but I highly recommend buying this, because looking through it, I'm like, wow, this is great, you know, because people need steps. It's not even just like listening to the podcast. When you sit in front of a blank page, you just don't know.
Right.
And
We
so
tried to make it a little more systematic and programmatic so that people can have something to do. I know that most people don't get through it in exactly 30 days. That's fine. It may take you 6 weeks. It may take you 5 weeks. It may take you 8 weeks. But the point is, you've got a systematic progress to make. And it's probably the cheapest form of self-psychotherapy you could possibly do.
Yes.
Compared to how much, you know, individual therapy costs in the community.
Absolutely. How are we on time? Are you okay?
Yeah, I have about another 10 minutes.
Okay, another 10 minutes. Well, do you want to talk a little bit about the workshops that you're offering?
Well, I'm doing, of late, I'm doing a healing group. And so the idea is, once I diagnose people either in the office, or I'm doing a lot of telemedicine, telehealth now. So I'm able to, during this coronavirus pandemic, they've loosened the rules a little bit about doctors seeing people out of state because of licensure and malpractice. So I'm able to see people right now in 43 states, and I'm taking advantage of that to expand my practice. And I'm seeing people in Texas and in New York and in other states. And we're coming together, you know, people are coming together on this once a week, 90-minute group that we're doing. And we, as a psychologist, Dr. Justin Barker and myself, and 8 patients approximately. And we meet, we talk about how the week has been in terms of their symptoms, in terms of their emotions. And we discuss skills, we discuss challenges, we discuss successes. We break out into smaller groups to discuss psychological issues and defenses and rationalizations and things that people do. Come back together at the end for a checkout. It's really been a very meaningful group for people who've been involved. Some have been involved for 6 weeks. Some have been involved for 4 weeks. Some people come in for a week or two and then, get back into the rest of the program. My program, once I diagnose somebody with TMS, includes education, books you can read or listen to, such as the one mentioned earlier. It includes journaling, which we've discussed. It includes psychological understanding, which is from the journaling or from the group, or sometimes individual psychotherapy referrals to people who specialize in the mind-body connection. We also talk about increasing your physical activity and other things that people are often afraid to do when they're in chronic pain. So it's a pretty comprehensive approach. And then there's follow-up with me by either video medicine or in person. And we have a very high success rate. I've published some research studies, outcome studies. We have a high success rate of people getting better, even getting off medications if they're on it, and getting more active, less pain, living their life again, as I was able to when I learned about this problem many decades ago.
Now, the workshops, you have to be diagnosed first before you can participate in these workshops.
Yes, diagnosed by either me or by another doctor who does this mind-body work. There's a number of them listed on my website in different states. So if you are in a different state and would prefer to see someone in your area, you can certainly do so, and I can still work with you on the group. But again, with my ability to do the telehealth right now, it's pretty easy for people to see me, not just in California. They no longer have to drive to the office. I mean, obviously there's some advantages to the face-to-face and the physical exam and all of that in the office. But for people in Northern California who used to fly down, now they can do the telehealth for the initial visit. And I can review MRIs and other things that they send to me by mail, as well as a detailed consultation. And I'm seeing people, as I mentioned, from other states as well on the telehealth, some of whom used to fly in for an initial consultation to Los Angeles, and now they don't have to. So it saves them time and money on that, and it keeps them free of this viral epidemic.
Right. Wonderful. Thank you so much, Dr. Schechter. Is there anything else you wanted to add before we end our interview?
No, I enjoyed speaking with you about the subject. I appreciate your interest and your passion in this subject, and your and your compassion for people who are suffering. And I hope that we can get the word out to more and more people.
Me too. And I definitely can think of another interview that I want to do with you around teenagers.
Oh, okay, great.
So we'll connect on that.